Thank you, Madam Chair, and I want to thank the witnesses for being here because this hearing is an important step towards, or forward, I should say, in protecting access to abortion and stopping unnecessary state laws that intrude on a woman's ability to exercise her constitutionally protected right to abortion. But I wanted to focus on the actual bill today and what that means for abortion access. So let me start with Ms. Northrup. Will you discuss why you believe the Women's Health Protection Act is necessary and what effect the bill would have if it became law? Briefly.
So yes, necessary. Yes, necessary, as we've been talking about this morning, the avalanche of laws. And what the Women's Health Protection Act does is make sure that doctors have a right to provide services free from unnecessary regulations and unscientific regulations, and women have a right to get that care. And what it does is both specify the type of medically unnecessary laws that are burdensome, so admitting privileges, like we're twice up in the Supreme Court fighting about that, even though the Supreme Court has decided, waiting periods that aren't medically necessary, the kind of hallmark or hallway restrictions and so forth that aren't necessary, and that it also provides a broader test for new kinds of things that will come up to make sure that they are medically based. And the reason why it's necessary, even though we win hundreds of cases, including the last one in the Supreme Court, even after we won that Supreme Court case, over 100 new restrictions were passed in the state, disregarding the Supreme Court's clear guidance that you have to actually advance women's health. The Supreme Court found that Texas's admitting privileges did not advance women's health, but the laws keep coming. We need a statute that makes it clear that we're going to have fact-based, medically based, scientifically based regulations, not these underhanded tactics to shut clinics and block women from care.
Well, thank you. Dr. Robinson, how would the bill change your practice if healthcare providers had a statutory right to provide abortion services and that your patients would also have a right to receive such services? Briefly.
Well, we know that abortion care needs to be safe and it needs to be readily accessible for all patients. And these restrictions are making it where it places barriers that makes it more difficult for these patients to access the care that they need. So the Women's Health Protection Act will ensure that patients can receive the care they need without constant regulations coming down that are constantly chipping away at that care.
All right, thank you. Now back to Ms. Northrup, and maybe just yes or no. Would the bill in any way require or mandate that providers provide abortion if they did not want to?
No.
And can you describe how the bill would impact the limitations and restrictions that have been placed on abortion care at the state level? For example, would the requirement that a provider offer medically inaccurate information in advance of an abortion be allowed to stand? Why don't you just address that since you kind of addressed the others before?
No, you cannot. The Women's Health Protection Act would stop these laws that require doctors to provide medically inaccurate information to women. So, for example, right now there are many state laws that are requiring doctors to tell women that medication abortion is reversible. I mean, that is scientifically untrue. The American Medical Association is suing the state of North Dakota on behalf of the doctors in that state to say you cannot force doctors to tell patients things that aren't true.
All right. Now, it's my understanding that the bill specifically ensures that state laws can be maintained if they demonstrate that the requirement significantly advances the safety of abortion services or the health of patients. Is that correct?
Absolutely.
Well, given this, is there anything in the bill that would make the provision of abortion care less safe? Because I know we've heard that from some of them.
Absolutely not, and has been clear by the American Medical Association, including in their brief they just filed in the Supreme Court, abortion is a safe procedure.
Okay. I just want to thank you. The bill, in my opinion, is critical to ensuring that healthcare providers can provide the care they're trained to provide, free of unnecessary restrictions. I always worry about, efforts on the federal level, let alone the state level, where we try to tell doctors what they should do or not do, even though they're the experts. And, so I think it's important that patients get the care they need and that they're constitutionally entitled to. And I'm proud to support the bill, and I believe it's an important legislative solution to protect access to abortion, which increasingly is not available. And as Dr. Robinson pointed out, it can't be that in New Jersey you can get an abortion, but in Alabama it's almost impossible. So I appreciate all of your statements. Thank you. Thank you, Madam Chair.